All right, so today we're going to look at chapter 20, which is the heart. And we're going to look at the organization of the cardiovascular system, and then we're going to go into parts of the heart, and then we're going to look at a little physiology as well. So before we get started, I want to explain to you that there are two different circuits in the cardiovascular system. One is called the systemic circuit, and the systemic circuit is the circuit where blood is transported from your heart throughout your body and then back to the heart again. It's different from the pulmonary circuit, which is where the blood flows to and from the lungs. So if we look at this picture here, we can see this, here's your heart right here, right? So that whole thing is your heart. And then there are these blood vessels. Here's a blood vessel. And then here's a blood vessel, and they're going to this lung. And then we see on the side, here's a blood vessel, and here's a blood vessel, and they're going to this lung. So that is called your pulmonary circuit. So the pulmonary circuit is, it's just going from the heart to the lungs and then back to the heart again. And any blood that is going away from the heart and towards the lungs, the reason it's doing that is because it is going to go there to pick up oxygen. And then after it picks up oxygen, it will return to the heart through other blood vessels to bring the blood back to the heart so the heart can then pump it to the rest of the body. Okay, now let's look at the systemic circuit. So with the systemic circuit, we have the blood vessels leaving the heart. Oops. Leaving the heart here. And so you can see a big blood vessel there, and it's leaving the heart. And then it's branching off, and it's going to all parts of your body, all over the place. And then it's going down through these red blood vessels, and then at the end, it comes back up through these blue blood vessels, and those vessels are going back to the heart again. So that is called the systemic circuit. So in other words, the systemic circuit is blood that's pumped from the heart to the tissues of the body, and then back to the heart again. Whereas that pulmonary circuit, the blood was pumped from the heart to the lungs, and then back to the heart again. So that's the difference. And we're going to see the vessels when we get to chapter 21, and then we can talk about that a little bit more. But I just wanted you to know the difference between the pulmonary circuit and the systemic circuit. So here we see a picture of the heart, and the heart sits in the thoracic cavity. So if you remember, this big diaphragm muscle here separates the thoracic cavity, which is up here, right, from the abdominal pelvic, which is down here. So everything above the diaphragm is called the thoracic cavity. And so when we look at the important organs in the thoracic cavity, we have the left lung, we have the right lung, and then we have the heart. So the heart sits right above that diaphragm, and at the very top of the heart, where there's kind of a flat base there, we call that the base of the heart. And then the heart comes down to a tip on the left side, and we call that the apex of the heart, right where its tip is on the left side. We can see that there are some major blood vessels coming off of this heart up on the top, and so those blood vessels are contained in this area in between the two lungs, and we call that area the mediastinum. So any blood vessels where blood is being pumped away from the heart, that is called an artery. Any blood vessels where blood is coming back to the heart, that is called a vein. So we're going to talk more about arteries and veins when we get to chapter 21. For right now, I just want to continue talking about the heart. So the heart itself is surrounded by a serous membrane, and that serous membrane is called the pericardium. So the pericardium sort of surrounds the whole heart here. And we're going to take a look at the layers of the pericardium in just a slide or two. Here's another picture of the heart so you can kind of see its placement. You're looking at a view where you're looking from the top of the heart down. So it's almost like they cut off the top of this person's body and they're looking down into their cavity. You can see the breastbone is right here on this side and the spine is back here. And then this is where the heart is sitting. It sits right behind that breastbone. So we know that's where we usually do heart compressions when you're doing CPR. And the heart sits in the pericardial cavity, and it's underneath this pericardium. So the pericardium, this is the serous membrane. It's like the sac that it sits in. And then the pericardial cavity, that is the whole place, the whole cavity that the heart and the pericardium sits in. So if we look at this, we can see that the pericardium has two layers. There's one layer that is very closely attached to the heart. It's very, very closely attached to the heart. And that layer is called the visceral pericardium. So we could say that the visceral pericardium covers the heart. Then there's a space, and so you can see the black space here, right? And then that is called the pericardial space. And then there's an outermost layer here, and that outermost layer is called the parietal pericardium. So we can see that goes all the way around like this, and that is called the parietal pericardium. So we could say that the parietal pericardium lines the cavity. The parietal pericardium sits on the outside, the visceral pericardium covers the inside, and then there's the space in between them, and the space in between them contains the serous fluid, or pericardial fluid, if you will. And so this membrane is necessary for when the heart beats. It is not going to rub up against any tissues against it. That space there with that serous fluid helps to reduce friction when the heart beats. Here's another picture of the heart, and we can see where it sits behind that the breastbone or the sternum. So you can see the heart is way up here, and we do see that it does come off to the left side a little bit. That's because this over here in this area, this is the left ventricle, and the left ventricle is just a little, it's bigger than the right ventricle. And here we have that point of the heart, and that's called the apex. And up here where it's flatter, you can see it's more flatter there, that's called the base of the heart. So we can see that the heart extends from about the second rib all the way down to about the fifth rib. So first we're going to look at superficial anatomy of the heart. And so what we see here is there's actually 4 different chambers of the heart. And so I want you to see those 2 chambers, or all those chambers first. So here's the right atrium. That's one of the chambers on the top, and it's on the right side of the heart. And over here we have the other atrium, which is called the left atrium. Now the atrium, they have sort of a wrinkled appearance on top, and that wrinkled appearance we call the auricle. The auricle is really just the outer portion of the atria, and they're wrinkled and when they're empty, and then when they fill up with blood, then the wrinkles disappear as those atrium are expanding. The chambers that are more inferior to the atrium are called the ventricles, And right here where you see this fat, that is in an indentation that kind of separates the right ventricle from the left ventricle. So over here on the left ventricle, on the left side, we have the left ventricle. And also we have that apex, so we know where that apex is. That's the left side of the heart. Then below the right atrium, we have the right ventricle, which you can see just on the other side of the indentation. Now I do want to talk about those indentations too. So we see that indentation here, it's filled with this fat, and you can see red and blue vessels in there. That is called the anterior interventricular sulcus. So the name tells you what it is. This is a structure on the anterior side of the heart. Interventricular means it's between the ventricles, and it's a sulcus, which means it's an indentation. So that indentation filled with fat and blood vessels is called the anterior interventricular sulcus. We also see fat over here that has blood vessels and arteries and veins in it, and fat as well. And so that's dividing the atrium, the right atrium, from the right ventricle. That is called the coronary sulcus. We would also see that as well over here on the left side. So the coronary sulcus wraps itself around the heart, and it separates the atria from the ventricles. Right? So you need to know that. You need to know coronary sulcus. That's the indentation between the atria and the ventricles. And you need to know the anterior interventricular sulcus, which separates the right ventricle from the left ventricle. Now there's also a posterior interventricular sulcus. And the posterior interventricular sulcus would be an indentation showing the division between the right ventricle and left ventricle, but on the back side of the heart, on the posterior side of the heart. So we can also see some blood vessels here, some major blood vessels that are bringing blood to the heart and taking blood away from the heart. The first one that we see here is this big red one, and there's these 3 blood vessels coming off of it. This one is called the aorta. So we have the aorta there. And the aorta is going to carry blood from the left ventricle to the rest of your body. When we look inside the heart, we're actually going to be able to see that hole in the left ventricle going up into the aorta. Then we also have this big blood vessel right here, and this one is called the pulmonary trunk. So right here is the pulmonary trunk. And the pulmonary trunk quickly divides into a right and a left pulmonary artery. There's the left pulmonary artery this way, and there's the right pulmonary artery going this way. This, as the name implies, with pulmonary, it's taking blood from the right ventricle, and it's going to carry it to the 2 lungs. The left pulmonary artery takes that blood to the left lung, and the right pulmonary artery is going to take that blood to the right lung. Then we have this big blood vessel that we can see right up here, and this blood vessel is called the superior vena cava. So this blood vessel is draining the blood from your head and your neck and your arms, and it's draining it into the right atrium. We're going to see on the other side of the body that there's another one, another vena cava called the inferior vena cava, and that is going to be draining blood from your extremities and abdominal pelvic area and bringing that back to the right atrium. So here we're looking at the back side of the heart, and I want to start with what we already know. Here's your left ventricle, here's the apex, so we know that's the left side of the heart. Here is the right ventricle over on this side, over here. And so we can see that fat and the blood vessels right there in the posterior interventricular sulcus. And we can also see the fat in between the atria and the ventricles. And again, that is called the coronary sulcus. So those are the areas that we already know, as well as here's the left atrium and here's the right atrium. So now we can see the blood vessels that are returning blood to the heart. We can see those much better. So if we look at the right side of the heart, this is the superior vena cava. It's draining, like I said, your head, your neck, your arms. It's draining the blood from those areas into your right atrium. And this down here, this is the inferior vena cava, and that's draining your legs and your abdominal area, as well as your pelvic area. So the superior vena cava drains your head and neck and arms and upper chest. Okay, so blood's draining back into the right atrium. Now, if we look at the left atrium, we can see that there are these pulmonary veins here. And these pulmonary veins are receiving blood from the lungs. So on the left side here, we have the left pulmonary veins draining blood into the left atrium. And over here, we have the right pulmonary veins, and they are draining blood into the left atrium. It's coming from the lungs. We can also see those other major blood vessels like the aorta up here, and we can see the left pulmonary artery and the right pulmonary artery here. So this is where that pulmonary trunk divided into the right and the left pulmonary arteries. So the best thing for you to do at this point would be to stop this video and to pull up that diagram of the heart and label that. Here's one of the diagrams that I'd like you to label. So you can start with this one. This is just labeling the different parts of the heart. And you can see that part of the heart has been dissected. So there's a frontal section of it. So you can see inside the atria and the ventricles. One of the things I'd like you to note on this diagram is that the walls of the ventricles are a little different. So this is over here. This is the right ventricle. And on the opposite side, on the left, this is the left ventricle. And look at the thickness of the walls. So the left ventricle is, the walls are much thicker than the walls of the right ventricle. That's because the right side of the heart sends its blood to the lungs, and it's a pretty short distance away, so it really doesn't need a whole lot of muscle tissue or muscle strength to get the blood that far. However, when you're looking at the left side of the heart and you see how thick those walls are, that's because the left side of the heart has to send the blood to the entire body. So the left side of the heart is going to be thicker than the right side of the heart. There are 3 layers to the heart that you have to know. The innermost layer is called the endocardium. The endocardium has a couple different layers to it, but you will be seeing this diagram in the lab exam, and so you need to identify this entire area here. This is the endocardium. So here is the inside of the heart, and the endocardium is what lines the heart on the inside of those chambers. Then we have the middle layer of the heart, and the middle layer of the heart is all muscle cells. So they all look red, and you can see that they all have nuclei. So this whole area in here that contains all of this muscle, these are all cardiac muscle cells, and this is called the myocardium. So it has some connective tissue, but it's mostly made up of those cardiac muscle cells that contract. Then we have the outermost layer here, which is called the epicardium. So this all in here, this whole layer here is called the epicardium. Okay, so epicardium. Now the epicardium has the same exact name as the visceral layer of the serous pericardium, or the visceral layer of the pericardium. Then there's that space, which we call the pericardial cavity, and then we have another layer out here. This is the outermost layer of the pericardium, and that is called the parietal layer of the pericardium. So for the lab exam, you need to identify this epicardium. And just remember that it is the same thing as the visceral layer of the pericardium. So now we're going to take a look at the inside of the heart, and we'll start with the right atrium. So here's the right atrium, right here. And there are 2 major blood vessels that are draining blood into the right atrium. The blood vessel on top, which we've already said, that is the superior vena cava. Okay, so vena means vein. Superior, it's on top. It's a very large vein, and it's draining blood into that right atrium. Then on the bottom here, we see the inferior vena cava, and the inferior vena cava is draining blood into that right atrium as well. So you're going to see some big openings there where the vena cava are draining into that right atrium. Then if we look, we can see a little tiny indentation right there, and that is called the fossa ovalis. So it used to be called the foramen ovale, and that was before the baby was born. And the foramen ovale was a hole. It was a hole going from the right side of the heart over to the left side of the heart. So it was a hole from the right atrium to the left atrium. But as soon as that baby was born and the baby took its first breath, then that hole closed up and became known as the fossa ovalis. The other thing that we see in the right atrium is there's a big hole there going into the left ventricle. So blood can flow from the right atrium into the right ventricle. Then we see these sort of flaps. So these are tissue flaps. We can see two of them right here. Those are valves that can close up that hole if they shut. And those valves on the right side of the heart are called the tricuspid valves. We could call them the right atrioventricular valve. And that's very descriptive because it's telling you that the right atrioventricular valve is a valve that covers up the opening between the right atrium and the right ventricle. Most of the time, though, you're going to hear it as the tricuspid valve and not the right AV valve. Okay, so that's it for the right atrium. Then we look at the right ventricle. Blood is going to flow from the right atrium into the right ventricle. In the right ventricle, we see that these tricuspid valves are being held down tightly to the wall of the ventricle, and they're being held down by these little cords that we call the chordae tendineae. So here you can see them there's the name, chordae tendineae. It's showing where they are on the left side of the heart. Those cords are called the chordae tendineae. And the chordae tendineae are attached to these muscles of the wall of the ventricles, and that muscle is called the papillary muscle. So those are holding down pulling on those chordae tendineae and keeping the tricuspid valve open. All right, so then let's move on. So from this right ventricle then, blood would flow into the next place where there's an opening, and that next place is this big blood vessel right here, and that is called the pulmonary trunk. That is the pulmonary trunk. Now we see that there's these other structures right there that look like they're occluding that opening, and those are also a valve. They're not cuspid valves. Instead, they are what we call semilunar valves. And so semilunar valves just have a little bit of a different structure. We call them semilunar valves because lunar means moon, so they look like half moons, right? So this one, because this semilunar valve is protecting the opening into the pulmonary trunk, we call it the pulmonary valve. You'll also hear it as the pulmonary semilunar valve. So blood flows into the pulmonary trunk, and then the pulmonary trunk divides right away into a right and a left pulmonary artery. So the left pulmonary artery will go to the left lung, and the right pulmonary artery will go to the right lung. The arteries take the blood to the lungs, and they fill up with oxygen at the lungs, and they get rid of the carbon dioxide. So now the blood will leave the lungs and head back to the heart. And when the blood comes back to the heart, it's going to go back to the left side of the heart, and it's going to go to the left atrium. So we see that blood returning to the left side of the heart returns through veins, and these are called the pulmonary veins. So there's two pulmonary veins bringing blood back to the left atrium, and then we also have two, and you can't see it on this picture, but there are two right pulmonary veins also bringing blood back to the left atrium. From the left atrium, then blood will flow through this hole. There's an opening then in between the left atrium and the left ventricle. And as it passes through that hole, it has to pass by another cuspid valve. So here's the cuspid valve for the left ventricle, for that opening into the left ventricle. And we give this valve a number of names. We can call it the mitral valve. That is probably the most common one that doctors use. It's also called the bicuspid valve. So on the right there was a tricuspid, on the left there's the bicuspid. And we can also call it the left atrioventricular valve. So it really has three names, but most likely we'll call it either the mitral valve or the bicuspid valve. Then the blood flows into the left ventricle, and we can see again that the walls of the left ventricle are much thicker. And we can see that that bicuspid valve, that mitral valve, is being held down again by these chordae tendineae. And the chordae tendineae are attached to these papillary muscles. So that's the same on the right and the left side. So from the left ventricle then, blood will be moving into the aorta. And so in order to move into the aorta, it has to pass through another semilunar valve, and we can see part of the semilunar valve right there. And so we're going to call that, since it's passing into the aorta, we're going to call it the aortic valve or aortic semilunar valve. From there, blood flows through the arch of the aorta. So the aorta has an ascending area where blood is moving up, and then it arches around, and we call that the aortic arch. And then the aorta starts to descend through the thoracic cavity, and then that part of the aorta we call the thoracic aorta or the descending aorta. Here's a cross-section of the ventricles, and I just want to demonstrate here the thickness of the ventricular walls. So here's the right ventricle, that's how thick its walls are, and it's going to be pumping blood to the lungs, which is nearby. And then here's the walls of the left ventricle, which are much thicker because they have to pump blood to all the rest of the body, including all the way down to your toes, into all of your abdominal organs, into your brain, everywhere in your body. So the heart has to be much stronger on the left side of the heart, as that blood is going to be pushed to your entire body. So in addition to those major blood vessels, we also have blood vessels that will supply the heart tissue with oxygen and nutrients, and also drain that. So there are artery and veins that we call the coronary vessels. So coronary, meaning heart, blood vessels. These are the blood vessels that are going to supply the muscle tissue of the heart. So the other blood vessels that we were talking about, those major blood vessels, they don't supply the heart muscle, they supply everything else in the body. Let's start by looking at the coronary arteries. So at the arch of the aorta here, you have this at the arch, the blood is coming right from the left ventricle into the aorta. And so the blood on the left side of the heart, that's come directly from the lungs. And the lungs are bringing in oxygenated blood. So the oxygenated blood comes into the left atrium, it goes down into the left ventricle, and from the left ventricle, it goes all the way into the aorta. So this is highly oxygenated blood. It's just coming right from the lungs. And so this, the heart tissue is going to want some of that highly oxygenated blood. It's a muscle tissue, so it needs the oxygen to make the ATP to make those muscles contract. So there are these two small blood vessels coming off the base of the aorta. There's one on the right and there's one on the left. The one on the right is called the right coronary artery, and the one on the left is called the left coronary artery. Right? So they're going to deliver the oxygen to all of the muscle tissue. Now, they are going to split pretty quickly. So the left coronary artery splits into a circumflex artery and then into an anterior interventricular artery. The circumflex artery goes around to the back and supplies the back of the heart. The anterior interventricular artery is going to supply the front of the heart. That right coronary artery is going to run through that coronary sulcus, and as it's running through that coronary sulcus, branches are going to come off and will also help to supply the front of the heart. After those arteries have dropped off oxygenated blood, they're going to bring the deoxygenated blood back to the right atrium. So they're going to do that through a couple of veins. The first vein you need to know is called the great cardiac vein. This is the vein that's found in that anterior interventricular sulcus. And if you'll note here, you're going to see that the arteries are red and the veins are blue. Okay, this is only true in the systemic system. When we talk about the pulmonary system, it's going to be the exact opposite. The arteries will be blue and the veins will be red, but we'll talk about that in a different chapter. But when you're looking at the coronary vessels, you should know that the arteries here are in red and the veins are in blue. So we have the great cardiac vein, and we can see that on the front. And if we look at the back of the heart, we can see this great cardiac vein right here. As it continues around, it started in the front and now it's wrapping its way around. It was in that anterior interventricular sulcus and it came up towards the coronary sulcus and now it's wrapping around to the back of the heart. Okay, so it wraps around and it drains into this larger expanded area here that we call the coronary sinus. And then the coronary sinus is going to drain into the right atrium. Now we also have another vein that's in the posterior interventricular sulcus, and that posterior vein is called the middle cardiac vein. So the middle cardiac vein also drains into that coronary sinus, and then the coronary sinus, of course, drains into that right atrium, right? So those are the blood vessels, the coronary blood vessels that you need to know for this class. So I want to show you this picture because this picture is showing how sometimes these coronary vessels can narrow, and we call that atherosclerosis. And so fatty deposits and plaque and calcium deposits, they can all deposit into those lumen of those coronary vessels, and they can narrow the arteries. So here we see on the front of this one, this is a normal artery, and you can see there's no deposits anywhere, and the blood is flowing quite well. And here's the cross section of it. It looks nice, wide, open. But then here on this side, we see some of the calcium and plaquing and lipids, and they're sticking to the sides of the walls there. That's called an atherosclerotic plaque. And so now over here we look at the cross section of it, and this is the actual inside of that coronary vessel. And so instead of having this whole area, we have only this much area for blood to flow through. So it's quite a bit narrowed. Over here we went from this full amount down to about this amount, right? So you really don't have, if there's atherosclerotic plaquing, now you don't have a whole lot of space for that blood to flow through. That can lead to a heart attack if the muscle tissue doesn't get enough blood. Here we're seeing an angiograph, and so we can see the dye going through the arteries, and on this side over here, we can see a normal heart, so we can see blood flowing to all the ends of the heart. It looks like the whole heart is getting plenty of blood, and so those arteries are nice and open. But then when we look at this side, this is an advanced coronary artery disease. So here we see some arteries are bringing enough blood, but then this whole area that's in black, that's because these areas over here on the heart, they're just not getting enough blood, and there's occlusion of some of those blood vessels so that they're not able to bring blood. Occlusion meaning there's plaquing, and this person is not able to get enough blood to all the tissues of his heart. So now we're going to look at some other cells that are in the heart, and these are the conducting cells. So most of the cells of the heart tissue are contractile cells. Contractile cells mean that they can actually contract, they can shorten, they can create tension, and they would actually be able to squeeze the heart. But there are some cells that are called the conducting cells. Conducting cells have an automaticity. So it sounds like automatic, right? An automaticity. This is the ability of the cardiac muscle tissue to contract on its own in the absence of neural or hormonal stimulation. So you might have seen those movies where they take a heart out and the heart keeps beating even though it's outside of the body. It's because of these conducting cells. There are these cells that just conduct and create action potentials on their own. So these conducting cells make up the system that we call the conducting system. And there's several groups and pathways involved in this conducting system. The conducting cells are responsible for initiating and distributing the stimulus to contract. So let's look at the different components of the conducting system. We're going to start by this group of cells right up here. This group of cells is in the right atrium. It is called the SA node, or the sinoatrial node. So on the lab exam, which you'll see this picture on the lab exam, you will have to identify that as the sinoatrial node. You will not get credit if you just abbreviate and say SA node. So the SA node, or the sinoatrial node, is located in the wall of the right atrium. And it has its own automatic rhythm where it puts out action potentials. It'll put out 80 to 100 action potentials per minute, right? So now you would think that if the action potentials are 80 to 100 action potentials per minute, that the heart would beat 80 to 100 beats per minute because it's receiving that message. But in actuality, the heart is only going to beat probably around 70 to 80 beats per minute. The reason for this is there is a nerve which we've heard about called the vagus nerve, and the vagus nerve is part of the parasympathetic nerve. Remember, it's cranial nerve 10, and so it slows down that SA node. But without that vagus nerve giving that tone and always sending action potentials to slow it down, without that, the SA node would send out 80 to 100 action potentials per minute. Now, from the SA node, those action potentials stimulate or propagate through these pathways here, and these pathways are called the internodal pathways, right? Internodal pathways. And they send down information to this group of cells. And this group of cells is called the atrioventricular node. Now, the atrioventricular node, it's located between the atria and the ventricles, and it is going to receive those action potentials from the SA node, and it will just pass them on. But if the SA node were not functioning properly and it wasn't working, the AV node could actually generate their own action potentials as well. If the AV node were to be the cells to set the rhythm, the action potentials would only be created at 40 to 60 action potentials per minute. So 40 is pretty low, 60 is pretty low. So normally the atrioventricular node just takes its instructions from the SA node. and we don't need to see this. But if the SA node gives out, then the AV node will take over. So from the AV node here, I should note that as soon as the action potentials get to the AV node, there is a 100 millisecond delay. And during that 100 millisecond delay, the atria are going to contract, right? Both the right and the left atria, which are receiving those action potentials from the SA node and the internodal pathway, they're going to receive those action potentials and then contract. So the AV node just hangs on to that for 100 milliseconds, and then it will propagate those action potentials down towards the ventricles. So the first pathway going towards the ventricles is called the AV bundle, and then the AV bundle splits into two bundles that we call bundle branches. And then each one of those bundle branches curves around the ventricles, and as it comes back up the outside of the ventricles, we call those Purkinje fibers. And after the action potential has been sent along these Purkinje fibers, then the ventricles will contract. So a couple of terms that we should know is bradycardia. So bradycardia is a slow heart rate. So this is slower than normal. A slower than normal heart rate. We have another term named tachycardia. And tachycardia is a faster than normal heart rate. These conducting cells that we're looking at only make up about 1% of all of the muscle cells in the heart. The other 99% of the muscle cells in the heart are the contractile cells. This is just showing a diagram so you can see the activity. Here we see that the SA node up here, that begins, the SA node activity begins, and the action potentials are starting in the SA node. Here it says 60 to 100 action potentials per minute. So if the SA node is only putting out 60 action potentials per minute at rest, that still is normal. And so then the SA node starts putting out those action potentials, and the next thing we see is that the action potentials start traveling through the atria, both the right and the left atria, and they're traveling through those internodal pathways. Right, so it's going to travel through the internodal pathway, and then at that point the atria are going to contract. Then there is a 100 millisecond delay at the AV node, which is right here. That gives the chance for the atria to contract before the ventricles get the action potentials. And then from there, the action potentials will travel down through the AV bundle, and then the AV bundle splits into the bundle branches, and then the action potential we can see moving down through those bundle branches. Then it gets to the tip of the ventricles, and at the tip of the ventricles, then the action potentials will travel around to the Purkinje fibers. Now note, as they're traveling up through the Purkinje fibers, that is how the ventricles are going to contract. They'll start contracting near the bottom here, and then the squeezing motion will lead upwards in the ventricle, so that as they're squeezing, all the blood is going to be pushed up towards the atria and the pulmonary trunk. Here's a picture of the muscle cells, of the cardiac cells. I just want to show you this because cardiac muscle cells differ from skeletal muscles in a couple of different ways. First of all, those skeletal muscle cells I said could be very long. So for example, in your quadricep muscle, that skeletal muscle could run all the way from your hip down to your knee. That's a pretty long cell. So cardiac muscles are going to be smaller. They're also going to have only one nucleus. So what we said was that skeletal muscle were multinucleated. So let's just write some of these things down. Cardiac cells versus skeletal muscle cells. Okay, so skeletal muscle cells can be very long, whereas cardiac muscle cells are small. skeletal muscle has many nuclei, whereas the cardiac cells have one nucleus. And then the other thing is that the cardiac muscle cells are branching, whereas the skeletal muscle is straight. Skeletal muscle cells are straight. And then lastly, the cardiac muscle cells have what are called intercalated discs. And so skeletal muscles don't have intercalated discs. Now, what the intercalated discs are is they connect individual cells. So they're going to connect, one cardiac muscle cell to another, and they're going to help to pass along those action potentials much faster so that you're not going to see individual parts of the heart contract. When the atria all receive those action potentials, they're all going to contract at the same time. So both the right and the left atrium contract at the same time, and then both the right and the left ventricles contract at the same time, and they contract very uniformly. All right, so that's all I'm going to talk about for today. So this was video 1 that you have to watch. Then you're going to have to watch the video on the blood flow through the heart. And then after that, you're going to finish up by looking at the cardiac cycle and some of the physiology that I need you to know for the heart. So please watch the next video on the blood flow through the heart.